Thank you for listening to this PYA webinar recast. PYA is pleased to offer this alternative way to access our thought leadership. This is a recording of a previously delivered webinar. The information is accurate as of the date of the original event. The video recording, slides, and associated material for this and all PYA webinars are available on our website at pyapc.com. This podcast is for educational purposes only. It is not intended to be used as legal advice or an official opinion.
Welcome to today's webinar. PYA understands the importance of clear, relevant, timely information to the industries we serve. So we offer a variety of webinars, white papers, articles, checklists, and other tools, all for free. Subscribe to our e-newsletters, follow us on social media, and subscribe to our PYA Webinar Recast podcast series for audio-only versions of all of our webinars at pyapc.com. Thank you for joining us. Here are today's presenters.
Hello and welcome to episode 2 of Revenue Recharge. Today's episode, we're going to cover the back end of the rev cycle. And I also want to say welcome back to our attendees from the first episode that both Sarah Bowman and Kristen Davidson covered when they discussed the front end and mid rev cycle. So today we're going to be speaking about the back end of the rev cycle. Just to ground everybody on this entire series, the purpose of this is really, we thought internally about how can we best serve our clients in identifying net revenue opportunities throughout the process. And we wanted to share that based on our client experiences, our professional experiences. And so we've put this series together really in categories and episodes that we want to share with our audience. So that's just a little of that background. And today we're going to be sharing some slides with some of the content on the back end of the rev cycle. And so you can kind of follow that. But at the end of this session, we'll be sending out a nice checklist, taking that content and putting that out, sending that out to you as for your convenience to kind of use within your own organization. So just want to give that background. So let's go ahead and we'll start with introductions. So I am Bob Paskowski. I'm a consulting principal and I work remotely in Columbus, Ohio. And before I joined PYA, I spent about 27 years with health plans, mostly provider sponsor plans with integrated health systems, and really got a good flavor for both how revenue works, both from a health plan and a provider perspective. Then I joined PYA about 8 years ago, and my role at PYA is to lead our managed care and revenue cycle service line. And most of our work relates to contracts, payer contracts, both from we sometimes just review them, but it can be as deep as going into the negotiations and sitting with our clients and trying to negotiate a fair contract for both parties. We also serve in many clients as an outsourced managed care function, which really gives us a good idea working closely with the revenue cycle team on what are the issues present in those organizations and really helping look at that back end of the rev cycle, whether that's with a just pure payment dispute, I've got a claim, it's getting processed this way, versus all the way moving toward if the parties can't resolve that, we actually help sit in an expert witness kind of role and try to kind of share our background on those particular instances. So I'll turn it over to Dave Hall.
Thanks, Bob. David Hall, I'm a senior manager based in Nashville, Tennessee. I've been with PYA about 2 years now. My primary role is supporting Bob on revenue cycle projects. And what we normally do is go into a revenue cycle situation with one of our clients, and we look where they guide us, and we try and check to make sure they're doing things appropriately. We offer suggestions for improvement, and we, in many cases, just give them comfort that what they're doing is correct. My background is, like Bob, on the payer side, but also on the provider side. I spent many years with a very large hospital organization, initially in the UK, which explains my slightly odd accent, and then for the last 15 years here in the States. Thank you. Back to you, Bob.
Thanks, Dave. Again, just want to reiterate, again, starting with this whole episode, we sat down as a team, Dave and I and others within PYA, and said, what are the best ways to identify these net revenue opportunities? And I think you'll find that these are pretty common of what you hear, but what we want to share is some of the success stories and some of our experiences, as again, we try to help identify those net revenue opportunities. So again, today we're talking about the back end rev cycle. And when Dave and I sat down to put together our content here, we found basically that these would fall under 3 different categories, and we'll dive deeper into this throughout this session. The first one is just engage with the key payers. We find that that's an important piece of understanding what issues are, and having those relationships are very, very critical. The second one was around leveraging applications and billing applications and other reporting tools. In other words, using your technology inside your organization to help identify these opportunities. And then finally is around developing robust policies and procedures. Again, the processes need to work for the opportunities to come. Okay, so let's move into, I'll just go ahead and just reveal all of these 3 as we get into engaging with payers. The first one we came up with was just establishing regular meetings. The second one is sharing systemic issues and trends in the claims process. Again, identifying and sharing real claims. And then the final one is around developing resolutions and timelines. So we'll pause there, and I'll let Dave provide some experiences with payers, engaging with payers, and what we've seen in our some of our client projects. So I'll let Dave provide some feedback.
Thanks, Bob. So my initial feedback on this is, in my first 10 years or so, I was on the provider side and really resolving many of the revenue cycle issues that I found. Part of the way I found to solve that problem was to have a really good contacts and know exactly who my counterparts were in the payer organization. So I could pick up the phone, they could pick up the phone, we knew who we were, and it was relatively easy to resolve most of the issues that we found on the revenue cycle between us. So I'd certainly recommend that. And since we've been going into our clients, again, this is part of the recommendations we develop with them, is how to reach out to the payers, how to set up those meetings, that, to establish a cadence so that they, like I did initially, learn how to really build those relationships and have people available to be able to reach out and solve an issue.
Yeah, and Dave, I'll add as well, as at least on this first item around the joint operating committee, I've actually seen that written in managed care contracts, where if there's any, I guess, dispute over issues, one of the topics is, hey, you would conduct or actually conduct joint operating committee meetings, establish them and conduct meetings, so that would help resolve issues. I'll share in a lot of our clients right now, those are pretty much, we're trying to just hardwire those conversations. It's so important to sit down and share. It brings the claims to life. So as opposed to somebody just sitting there looking at more and more claims and bills, you tell the story of, hey, this is a patient with X. Here's what we did. We asked for prior authorization. We sent in medical records. And again, just tell the whole story. It again brings it to life and makes it a little more relative when you're discussing any kind of dispute there. So want to make sure we have those meetings as much as possible. Sometimes there's maybe some reluctancy for the payers to join those calls. If that happens, I would say establishing a regular cadence with sharing of the information. Hey, here's a batch of claims, for example, that we continually see X in a delay. What are things we need to do to fix that claim? And again, there could be things on the provider side that we're not checking all the right boxes. The claims aren't going through clean, or the payer has a new edit that they've instituted that, hey, we just want to understand that information. That helps us, again, make that process a little bit smoother. And so that's a key one. Again, sharing real claims is certainly paramount. As far as resolutions and timelines, as much as you can put things in writing, both sides of those of the parties sharing information is helpful. Many times the contract will dictate timelines. You have to file a claim by this date. You have to process the claim by this date. If there's any dispute over that payment, you have a certain amount of timeline to submit information back and forth. So again, just making sure those timelines are kept. And then we're getting responses back. Always ask for timeline. When do we expect the medical record? When can we expect a claim to be processed? But again, at the end of the day, these payer meetings are really about bringing resolutions. And we know that hundreds and thousands of claims are processed in your organizations every day, and getting those brought to the forefront and resolved timely is certainly a win for both sides of the party, of each party.
And just to re-emphasize again, the importance of meetings, like this or face-to-face ideally, is very important. Sending emails is very impersonal, much more difficult to resolve something through email than just to pick up a call and to speak face-to-face to the person you're trying to resolve the issue with, but then record it. Follow up with an email, put a note in the patient account that this was the conversation, this was the agreement, this is what's going to happen next. Exactly as Bob said, make sure you get the timeline established, but recorded as well. Having that as a record of fact is very helpful as you then proceed to try and collect the money as you go on.
Yeah, and I'd also say it's okay to have open dialogue about timelines, and many times the people participating in these meetings have their superiors, and they're trying to resolve a claim issue or resolve a contract issue. It's okay to share that, hey, I've got a finance committee meeting that's coming up. I'd love to be able to bring something to that finance committee to share where we're at in a particular issue or how we're resolving claims, et cetera. So it's good to provide all that background to say we've got obligations within our organizations to share. And I also added here on the last item is around sharing options. And what we mean by that is making sure that we're sharing how other providers or other payers are processing these particular issues or these claims, and making sure they're aware that we're trying to resolve those. We're not seeing these issues in different environments. That's okay. I think that's important to share, and also share that there's resolutions within that contract that all need to be brought up. Again, we don't want to make this adversarial, but everyone has options, whether that's terminations or arbitration, those things, if really the parties come to an impasse. So again, it's just good to have that open dialogue to share about all the different options that the parties are considering.
Yep, and one of the things we've heard going into our clients is we've exhausted all our appeals. We can't do anything more. And the answer is invariably there's something within the agreement, within the contract, that allows you to escalate it beyond the appeals. So just giving up after the appeals is revenue that you've potentially lost. So just be aware of the options for escalation, the options to speak with key brokers, speak with employers, talk with your physicians, let everybody know that you're in this dispute position, and just don't give up, because this is the revenue that you want to capture.
Great. Dave, let's go ahead and we'll move to the next topic. Our second category is around leveraging billing applications and other reporting tools. So again, this is, you've have the relationship now with your payers, but like anything, you want to have as much information on what's going on with that revenue stream as possible. So here we're really talking about maintaining great records, and we'll get into some more examples here. Automating as much as possible, trusting and verifying your information, establishing work queues based on dollar scopes, establishing key metrics around measuring, comparing, and trending. And the last one is just, again, determining root causes and driving new interventions of how do we solve this. So I'll pause there, David, and maybe we talk about some of these individually or collectively here.
Absolutely. So maintaining great records, this is one that's an absolute key for me. The records that you keep as a provider organization really enable you to pursue accounts and claims and get paid what you're entitled to. I have seen, Bob and I have seen instances where some claims have really excellent records. We spoke to this person at the payer organization on this phone number on this day. This was what was agreed. It makes, following that claim right the way through to get it paid much easier than people who don't keep those records, who maybe keep a note in a book somewhere. It needs to be within the system. It needs to have a timestamp on it, a date stamp, who did it, who said it, and really having that great record gives you so much power as you go forward. And the other side of that is the data within the system. So again, bringing the information in electronically, automatically, avoiding any kind of manual intervention gives you so much more ability to be accurate and to trust the information that you see within the system.
Yeah, just again to emphasize the amount of volume. It just, as much as you can eliminate manual intervention, the better, because there's just lots of activity here. And again, just important to try to leverage those tools. And for, PYA as an organization has sat in an independent kind of a role where we're looking at all kinds of information, let's say in an expert witness case. And part of that story on each claim is to go in and look at the data. And so we'll get to a point where we're reading medical records. In some cases, we're reading call notes. We're looking at documentation. For example, that could be an appeal. It could be a call in to reconsider a claim. All those things kind of, again, tell that story on that one particular claim. If you get to a point where we have to have a third party actually try to resolve this, and obviously that's a challenge. And again, just high volumes of claims, and that, again, just trying to make that as simple as possible. So I also want to talk a little about establishing work queues based on dollar scope. This is where you should be working closely with your finance organizations and finance departments and other organizations, looking at that scope level. Again, sending it too low could mean that I'm just going to get inundated with the amount of claims and I won't be able to keep up, versus setting it too high and perhaps losing some opportunities to identify some net revenue there. So again, it's that just knowing your organization and again, having very open dialogue. What's the proper place to set that scope on reviewing of claims?
Absolutely, and it's a bang for your buck. The high dollar claims out there, obviously spend time on those, but also the claims where it's repetition. So if the same thing's happening many times, it's easy to then spend time on that particular subject, even if it's low dollars per claim. If you're doing 100 of those, it makes it worthwhile to spend the time on that issue as well.
Yeah, and it's sometimes interesting when we look at some of the metrics, we'll get the typical percentage of on a provider engagement where we're looking at payer mix and we're looking at percentage of collections by payer, by classification. Those are good metrics to have, but it's also good to have dialogue with the team that's working that information or behind the scenes in that, because they're going to know where the pain points are in the process. So having those dialogues beyond just the metrics is helpful. I guess to summarize this slide, it's all about being inquisitive, being a little bit like CSI and investigating of what are we seeing in the data that would lend to potential net revenue opportunities.
Absolutely, and going back to the trust and verify, the last thing you want to be doing is going to a payer, and I've done this myself, so beware, where something in the information that you've got is inaccurate. So again, go back, trust and verify. If you're going to make a claim to a payer, you want to make sure that you're accurate, because over time, having them and yourselves trust the data that you're exchanging is absolutely key. Anytime you undermine that, either missing something or somebody gave you some bad information, can undermine that trust, and it takes a long time to build it back up again. So just be aware of that.
Okay, so we've gone through. First one was engaging, with your payers. The second one is really using your billing applications and your reporting tools, and trying to make sure you're identifying opportunities there. And then our third topic is around policies and procedures. This can be challenging because there's so much activity going on in our industry that getting good documentation is really helpful in policies and procedures. We've basically boiled that down to three main items. First of all was around supporting staff development and training, making that a consistent process as much as possible. Establishing the process, innate policy and procedure for how to handle write-offs and adjustments. Again, that is directly affecting revenue recognition as you set those policies. And then the third one is around maintaining these policies and procedures based on industry trends. We know things are changing, as well as any payer trends. So let's, Dave, let's dive into that one a little bit more too.
Okay, the staff development and training. So your staff are out there trying to make decisions every day, and if they've got a really good policy and procedure for every step and every piece that they have to interact with, it gives them and you a lot of comfort that they are making the right decisions. So whatever decisions they make in terms of write-offs or adjustments are supported by the policies and procedures behind that. So it's very important to keep those policies and procedures alive, up to date, like a living document. And as Bob says also, so you can try and get in front of some of the industry trends that are happening. So anticipate that the payers are going to start writing off smaller and smaller claims, or denying them. Have a policy that starts to look at that and how you can guide your team, the revenue cycle team, and how to deal with these issues when they come up. Try and anticipate them. We look at a lot of the industry trends coming in. We're seeing, AI, we're seeing process automation on the payer side that is then impacting the claim denials and payments for the providers. So we want to be aware of those and try and get in front of them.
Yeah, and Dave, I'll also add again around this first one around staff. If for the people that participated in episode 1, that was a real emphasis by Sarah and Kristen around making sure that the staff are trained and all that. So this will permeate through, I think, a lot of the episodes of having the staff developed and understanding all the issues. So again, a point of emphasis there. On the industry or the trends, that one's ever changing. So I'll give an example on the industry trend. So in 2024, under the new Medicare Advantage rules, there's a process for the 2 midnight rule, for example. So again, looking at your policies and procedures, having to maybe amend those based on that, those rule changes, and there's more rule changes coming out on that. That's certainly pertinent, as well as payer trends. I actually sat in a meeting between a payer and a provider recently, and the provider was sending out their bills based on their processes, but yet the payer had different requirements, although both of them are trying to follow CMS billing guidelines. But the fact that the payer had some reimbursement policies that may have affected how that worked. So it just, again, that gets back to the first item around engaging with providers or engaging with payers to understand, what things are changing. So again, to make that claims process, the payment process to go a little bit quicker, again, having that dialogue. So those are things that are just trying to keep up with those trends is important.
And anticipating the data as well. So if you anticipate the certain element of your data is going to start trending down, then it makes sense to try and have a report or some way of tracking that in the system. Looking anecdotally at a single claim that's not going to tell you the story. You need to be able to track these over time. So if you are anticipating seeing a specific issue, or you start to see an issue, then build a report that shows you the answer. Having a robust report that you can trust to take to the payer and say, look, this is what's happening. Let's try and resolve this issue. You're impacting our revenue. And if you've got that data behind you, it's much easier to address that and then work it through with the payer.
Thanks, Dave. Well, we want to thank our audience today for joining us. As we said earlier, we'll take all the content and put it into a nice checklist for you and send that out after the session today. And we look forward to you joining many more episodes of Revenue Recharge in the future. Thank you.
Thank you.
Thank you for listening to this PYA webinar recast. The video recording, slides, and associated material for this and all PYA webinars are available on our website. If you have any questions or if we can help, please contact us at pyapc.com. Thank you again for joining us and have a great rest of your day.